Hello everyone. Today Dr. Nipun is going to demonstrate a very special procedure, intravitreal implantation of biodegradable dexamethasone implant, which is known as Ozurdex. So this is the packing of Ozurdex, and as we all know that ophthalmology underwent tremendous revolution with the introduction of drug delivery system. Now this drug is available to help so many patients of chronic macular edema following CRVO, and we have other formulations which are coming in the field of glaucoma. I would like to request Dr. Nipun to share the indication of Ozurdex implant.
Good evening. I am Dr. Nipun Bagrecha, Retina specialist at SuVi Hospital and LASIK Laser Center, Kota. So, Ozurdex is a biodegradable implant containing 700 microgram of dexamethasone. So, it releases 700 microgram of dexamethasone within 3 to 4 months in the vitreous cavity of the patient. The main indications for this are chronic macular edema due to vein occlusion and due to diabetes not responding to, and due to uveitis not responding to our routine anti-VEGF injections. So जो Ozurdex इंजेक्शन है ये एक ऐसा इम्प्लांट है जिनके मल्टीपल इंजेक्शन के बाद भी या जिनका पर्दे में सूजन कम नहीं होती रूटीन थेरेपी से, उनके लिए एक ये वरदान साबित हुआ है और इसमें इंजेक्शन के 1 महीने बाद ही बहुत अच्छा रिजल्ट दिखाई देने लगता है.
Thank you, Dr. Nipun. And today we have with us Dr. Aishwarya Parthasarthi, Dr. Rohitas and Dr. Prerna ma'am. So I would like to ask Dr. Aishwarya to say something about the indication of Ozurdex implant.
Yes, so Ozurdex, as Sir has said, if there is a refractory case in which after multiple injections also of the anti-VEGF the patient is not responding, moreover on the OCT if there are multiple hard exudates and hyperreflective dots that are seen in case of diabetic macular edema, in such cases also Ozurdex, that is the intravitreal dexamethasone implant, it has act as a dual thing that it reduces the edema because this edema is mostly inflammatory. That's why it's not efficiently responding to the anti-VEGF injections. But now after the implant, on the repeated subsequent OCTs in multiple cases we have seen that the edema has gone down and the patient's vision has come back, and moreover it works for 3 to 4 months. So we can avoid the monthly anti-VEGF injections. So yes, it's wonderful.
So that's wonderful, Dr. Aishwarya, that the Ozurdex injection can help these patients to avoid multiple injection of anti-VEGF. We have Dr. Rohitas with us. I would like to request Dr. Rohitas to share the contraindication for Ozurdex implant. In which cases you should use with caution or you should not use at all. Dr. Rohitas.
Thank you, sir. Ozurdex injection is contraindicated in some conditions like infection of bacterial, fungal or viral, and posterior capsular rupture or rent, and
so in posterior capsular rent, Dr. Rohitas mentioned very correctly, this implant can migrate into the anterior chamber, so we should be careful. And cases of glaucoma also,
advanced glaucoma case also contraindicated.
Okay, and in responder,
and in allergic case like allergy from the dexamethasone or implant contents.
Okay, so Dr. Prerna is with us. So I would like to request Dr. Prerna to share some tips like how when you inject the Ozurdex injection, what are the precautions you need to take in the mind while injecting this implant? Dr. Prerna.
So usually it's the same as most of the steps are same as that we do in the anti-VEGF. Just one important thing we have to remember, the diameter of the anti-VEGF injection, that is only of 30 number gauge needle, but Ozurdex has a more diameter, so we should follow Z technique. That is, we should implant the bevel of the Ozurdex implant in a Z so that the vitreous prolapse should be avoided. And important thing is we have to measure the side from the limbus, that is 3.5 millimeters, and the from in the pseudophakic patient. And also it is better to avoid in the phakic patient as it can also lead to the cataract formation. Thank you, sir.
Thank you so much. And now Dr. Nipun sir will inject the Ozurdex injection. Thank you. So Dr. Nipun, it comes in a packing like this.
Yes, sir.
Once you open it, what kind of precaution you should take before opening the package?
So the implant has a actuator and a safety knob.
Okay.
So we should not open the safety knob while before injecting. We should open the safety knob, and then we should have to be very careful so that while pressing the actuator button.
Okay. So come from here.
When the implant is inside the vitreous cavity, then only the actuator button we should press, and we will hear a click sound, and that means the implant is fully injected and inside the vitreous cavity.
Oh, great. So this comes like this, like a sterile package. You can open it, and Dr. Nipun will show it.
Yes.
So you should carefully inspect if there is any breakage in the packing, and it comes like this sterile pouch and should be opened very carefully, please. These are the arrows which are there to help you to open the implant, and then you can So Dr. Nipun, can you explain the implant? You can come
so
here.
this is the
Yeah.
Ozurdex implant by the this is by the AbbVie company. It contains 700 micrograms of dexamethasone, which is slowly released,
And
and
this
this
one?
is the
Yeah.
actuator button, and this is the safety knob, and this is the cap, and inside it, which is the needle through which we'll administer the implant in the vitreous cavity.
Pick ले लो.
So all patients who have hypertension and diabetes and chronic edema of the retina, this implant is very useful in ameliorating that edema.
Great. So after sterile precautions, after all sterile precautions and proper prep and drape, Dr. Nipun is going to inject the intravitreal dexamethasone implant. And which quadrant do you prefer, Dr. Nipun, inferotemporal or supratemporal?
I prefer generally the superior quadrant for the dexamethasone implant because of the Bell's phenomena. And under topical anesthesia, and after carefully painting it with betadine, and we ask the patient to look down, and she is a pseudophakic patient with cataract surgery already been done. So from the limbus 3.5 mm, we take as the marking.
Okay. So superior quadrant is advantageous because patient, because of Bell's phenomena, there is less chances of any exposure or infection.
Yes, sir. Okay. And the site of the injection will be covered by the lid also.
Upper lid.
Upper lid also.
Okay.
नीचे देखिए आंटी, नीचे.
So this is the application of the proparacaine eye drop soaked in cotton tip applicator. So this will help to anesthetize the eyeball, the area from where Dr. Nipun is going to inject the Ozurdex injection.
So we push the eyeball down and we mark 3.5 mm. And before inserting, we have to take out this safety knob.
So this is safety knob?
Safety knob is out now.
Okay. So
now we'll have to be very careful Now we will go 30 degree to the angle of the sclera.
Okay, 30 degree to the angle of sclera.
And once the bevel is little subconjunctival,
Yes. Once you injected the implant,
yes sir.
what precautions you need to take after implantation?
So after implantation, we need to press with the bud, and so that any bleeding or vitreous reflux is not there.
Okay.
And second thing, we need to check for the hand movements for the vision.
And we need to see the implant also.
And so you need to see the implant in the vitreous cavity also.
Okay. With indirect.
With the indirect. हाथ दिख रहा है माता जी आपको? उंगली दिख रही है मेरी?
देख रही उंगली? देख रही ना?
अभी कितनी है उंगली?
कितनी है?
हाथ?
हाँ, कुछ हिलता हुआ दिख रहा है।
हाँ, उंगली?
दो है? कितनी है?
कितनी है? दो है? उंगली हिलती हुई? अब माता जी? हाँ हाँ, बस अभी उंगली दिख रहा है? कितना है?
तो
बस ठीक है. So now Dr. Nipun is going to examine the intravitreal dexamethasone using the indirect ophthalmoscope. And so Dr. Nipun, how you will see with the indirect ophthalmoscope how it looks like?
Yeah. So very important point is the pupil should be well dilated before any Ozurdex implant. So the implant looks like a cylinder, and it is, I can very well see the cylinder in the vitreous cavity.
That's great.
And
Very wonderful, wonderful.
yeah.
Very good, very good. बहुत बढ़िया, wonderful.
It's in the vitreous cavity. It is perfectly floating. It is actually just inferior to the macula. So the
Okay.
site we wanted, so it is injected
Okay,
there
great.
only.
So Dr. Nipun, can you tell something about the Ozurdex implant? Like some of the studies done using this device and their outcome.
Yes, sir. So the various studies have done, and so they have shown a tremendous response with this Ozurdex response. Within 1 month, chronic macular edema has resolved to a great extent without much rise in IOP, and it's versus its counterparts with the fluocinolone acetonide implant, the IOP raise is very less as compared to its counterparts.
Okay, great.
And even in the phakic patients, the cataract formation is also very less as compared to the other implants.
Great. Thank you so much, Dr. Nipun. Thank you.